Good morning, everyone. Welcome back to Move Daily Talks. I'm your host, Tracy Steen. Today, I'm welcoming Jennifer Perez from Gait Happens onto the podcast. And we're going to talk all about feet, all things feet issues. And I have had my share of those things, which I'll be sharing in the podcast today. But she's got some good insight for us for sure. Dr. Perez is the co-founder and vice president, like I said, of Gait Happens, a global education company with a special interest in lower extremity biomechanics. She is also the co-owner of Kinetic Chiropractic in Lafayette, Colorado, where she helps patients of all ages, backgrounds, and athletic abilities. Dr. Perez holds a BS in kinesiology sports medicine and a Doctor of Chiropractic degree. She's lectured to healthcare practitioners across the US and internationally. As both an educator and clinician, her mission is to empower as many people as possible to take charge of their lower body health so they can get back to doing what they love. Amen to that. We need that lower body. My goodness, if you have been someone who's had an injury in the lower body, perhaps you've had plantar fasciitis or a bunion, those things can really deter you, can't they? And we don't want that. So I'm interested to speak with her today, get her insight, her coaching in order to prevent those things, or at least figure out what to do if we do have them. Okay, welcome with me, Dr. Jennifer Perez. And here we are with Dr. Jen Perez. I'm really excited to chat with you today. I was just saying before we started here that boy, oh boy, feet issues seem to be an issue for so many women, especially as we're aging. And what is that about? What is that about?
I think there's so many factors. You're absolutely right. Feet, there's a lot of pathology, there's a lot of opportunity for growth, let's put it that way, when it comes to symptoms that we experience in the feet, and especially as we age, and especially as women. There's so many factors that I'm sure we're going to get into with that, from the sarcopenia side of things, which I know you talk a lot about through your channels, but also through footwear. There's just a lot that affects our feet, and our feet, we're on them all day, so they absolutely need to be treated with respect.
And when you don't have a foot issue, life is grand, honestly. And the moment you have one, it sucks, right? And it just like, I think if something happened to my hand, I could still function, I could still walk, I could still do lower body. If I had a foot issue, and I have, it can derail you, can't it? You can really not only derail you physiologically, but psychologically as well.
Absolutely. And we know that, for example, if someone wants to take 7 to 10,000 steps a day,
Right.
half of those are going to be on each foot, correct? So if we have something going on in one foot, or worst case scenario, both feet, it's absolutely going to affect how much you're able to move, how you're able to get outside, get the fresh air, all of the psychological benefits as well as the physiological benefits.
Yeah. So there are a lot of common foot issues. One that I hear of a lot is that plantar fasciitis. Oh my goodness, it seems to be really common. And in fact, I had my first bout of that back in 2010. It was the Olympics here in Canada, in Vancouver. And I bought a pair of boots to go walk around the Olympic Village with. And the boots were flat, they weren't heeled. I was being practical. I was going over form, not fashion. But at the end of the day, I could barely walk. My one foot was just throbbing, and I had no idea why. I thought I had done something in the gym previously, which I may have. But so I got home, took the boots off, and didn't wear them for a while. It took a while for that to feel better, to go away so that I wasn't hobbling. And I put the boots back on for a weekend, and instantly it came back. And I was like, it's the boots. Oh my goodness. I didn't even think that it would be something like that. So can you tell us, let's go into plantar fasciitis. What is it? How can we avoid it? And then if we have it, how can we treat it?
Great questions. So let's just break down the plantar fasciitis in the beginning, right? So I have my trusty foot model with me, of
Awesome.
course.
So
Um,
if you're just listening, she just got a little bone foot model. So be sure to check out on YouTube if you want to see this full version. It's over on YouTube as well. Okay, go ahead, Jen.
Perfect. I'll try to be as descriptive as possible for those that are just listening. So the plantar fascia is the fascia that lives underneath the foot. So when you think about your foot, I think a lot of people imagine the foot to be what this model is, which is just a bunch of bones. But in reality, our foot is very complex. We have hundreds of muscles, tendons, and ligaments. We have 28 bones, 33 joints. They're designed to move. And then underneath there, we have 4 layers of muscles. So our feet are actually quite thick because they're full of muscles. And then surrounding the muscles is this tissue called fascia. And we have fascia all over our bodies. I think of it like, I like to call it the saran wrap of our bodies. So it's wrapping all of the soft tissues and connecting us in chains. So the plantar fascia is interesting because when we think about the chains of fascia, really, it's just one area of a line of fascia that goes all the way from our bottoms of our toes around the back of our legs and all the way up the back of our body to the top of our head. This is all one kind of line of saran wrap, if you will, but we just call the plantar fascia its own thing. So when you're thinking about this tissue, think about how it's connected rather than how it's isolated. So that's what the way I kind of like to start talking about that tissue. Now, what plantar fasciitis is in the beginning, it becomes kind of this acute inflammatory response where we're overloading a tissue, just like if we had a muscle strain or if we had a sprain of a ligament. When things become overstressed, they start to get irritated. So we can have an acute bout of plantar fasciitis, which is what sounds like it was happening with your boot situation. Or over time, if we don't change that load or if we don't allow those tissues to heal, it can become chronic. And this is where people are dealing with plantar fasciitis for years. And that becomes a much more difficult pathology to treat. Not that you can't. And I want to make that very clear because I do think that a lot of people, when they get the diagnosis of plantar fasciitis, tend to lose hope. They think it's something that they're going to have forever on and off, and that's not necessarily true. So the short version is the plantar fascia is being overloaded, and we need to figure out, number one, why, and how can we make that fascia more resilient?
Okay, awesome. Let's talk about that plan to make it more resilient then.
Perfect. So if you think about my favorite analogy for fascia, for muscles, for tendons is a team project. Everything is working together. And when things are working well, everyone has their own role that they should be playing, and things go great, and you get that A, or you get whatever project it is that we're looking for. But that's not always how team projects work, right? And oftentimes when one thing isn't pulling their own weight, somebody else has to pick up the slack.
Yeah.
So when it comes to plantar fasciitis, the number one thing that I see in my office, and there are different varieties, there's different things that can happen to overload that plantar fascia, but the number one thing that I see most often is a weakness of the foot. So going back to those 4 layers of muscles, that's the 4 layers of muscles that just live in the foot itself. We also have what's called extrinsic muscles, which are muscles that live in the calf that work on the foot. So we have a ton of different muscles that should be working together to make us efficient movers. But oftentimes our feet are not as strong as they should be. And this is a measurement that we actually take in our office. We have something called a toe dynamometer, which is probably my favorite word, which we use to measure toe strength. And that in turn measures our foot strength. And I can tell you from personal experience, from years of clinical practice, that I can count on my fingers how many people come in with adequate foot strength. And when we don't have that adequate foot strength, we're going to ask our fascia, our tendons, our ligaments to do a lot more work, and then they become overloaded.
So why do we not have strong feet? And are smaller feet less strong than bigger feet? Or is it just what we are doing to train the foot?
So great questions. So as far as foot size, like shoe size kind of size, I would say not necessarily, but it does come down to relative body weight. So if you think about it, right, someone who weighs 100 pounds needs their feet to be able to carry 100 pounds, but someone who weighs 200 pounds needs their feet to be able to carry 200 pounds. So our goal of foot strength is relative to body weight. We're looking for 10% of body weight out of the big toe and 7% of body weight out of the outer toes. Big toe is big for a reason. It's supposed to be stronger. But oftentimes, those numbers on average should be ranging between, let's say, 10 to 20 pounds for the big toe and 7 to 15 pounds for the outer toes. And I have people coming in with zeros and ones. So there's a big deficit between what we need and what we have. And going back to your question of why, I mean, I think that's a really great question. And the two biggest factors that I see are footwear and the lack of use of our feet. And what I mean by that is we can take 1,000 steps, but if we're in a shoe that's a built up super shoe that has a ton of cushion, has a big rocker to it, so you can just rock right over the shoe and not have to actually propel yourself forward, you're basically using a robotic shoe, if you will, to propel yourself forward rather than actually using your joints and your muscles and your tendons. So we're not loading those tissues anymore.
So the shoe is doing the work for us when we should be doing the work.
Exactly. Right. The more engineering you have in your shoe, the less you're going to use your actual foot, which was a marvel of engineering to begin with.
Isn't that funny how they create it to make it easier? Everything is created to make it easier for us when really it shouldn't be. We should be doing the work. I took a barefoot course years ago. It was barefoot training. And I remember the instructor coming in bare feet, and then she told us all to take our shoes off. And a number of the exercises, she would always say, okay, you're going to plant that big toe, plant it in the ground, feel the tension from the ground rise up through your calf. And it was very interesting to be mindful of planting that big toe and driving the heels of foot into the ground to anchor yourself. So it feels like that's kind of what you're talking about that we've gone away from.
Absolutely. And going back to what I was talking about before with those chains of fascia that are all connected. So going to the big toe, for example, another really big topic of conversation right now is the pelvic floor. And so with that, we actually have a line of fascia that goes from the inside of the foot up through the inner leg, the inner thigh, into the pelvic floor, and then it continues on through the diaphragm and up into our inner neck. But when you think about that connection, when you're able to anchor that big toe and lift from your arch and lift through your inner thighs into your pelvic floor, you get this kind of dynamic synergy where everything is working together, and it's really, really effective. There's actually a study that came out a few years ago on synchronicity, which is where our brain likes shortcuts, right? We like to save energy. We like to be efficient. And so one of the ways that our brain does that with the musculoskeletal system is by learning muscles that fire together frequently. So they started to study these muscles and the muscle groups that if I tend to fire this group, I'm going to fire this group with it. So the brain just starts automatically doing that. It's called synergy. And so they actually found a synergistic relationship between the big toe and the pelvic floor. Isn't that so cool?
That is amazing.
Not only are we having women who have struggles with plantar fasciitis, with foot pain, with bunions, for example, because all of this happens on what's called the medial side of the foot, so that inner side of the foot. But oftentimes my patients are coming in and I'm the first person that's asking them when they come in with the foot pathologies, what about the pelvic floor? Maybe they're multiparous. Maybe they've had multiple babies and they're like, no, I don't have any pelvic floor symptoms. I just pee a little when I'm on a trampoline on a Thursday and I've had 3 waters,
You're like, and there it is.
right? Like, oh, okay. Well, let's talk about that.
Okay. So say maybe we're currently in a bout of plantar fasciitis. I know one of the things that has been helpful maybe, I mean, you're going to tell me if it's been helpful or not, but a lot of people will take a golf ball and roll over the golf ball. What I understand is that when you're in the middle of a bout of plantar fasciitis, it's inflamed. You don't want to make it more inflamed by doing something like that. But what are some of the practical treatments that we could do if we're in that bout? How long is it supposed to take to heal that? And yeah, what are some contraindications or things that we shouldn't be doing?
Absolutely. Such great questions. So, starting off with the question about the ball. So, I am not anti-ball at any point. I just think you need to be smart, right, about how we're applying it. So, one of the things that I think people try to do is they really try to dig into the tissues and they think, you need more pain for that
Yeah, the
gain.
harder the better, right? Yeah.
Yeah, not true. So
Okay.
all we're looking for is a little bit of stimulus of those tissues. So even if you go light and quick and you just roll a ball underneath the foot, just to give it a little bit of sensation,
Okay.
going back to the gait theory of pain, which essentially says that our brain can only feel one thing at a time. So if you think about like a gate in front of your brain, then basically pain signals are slow. And so if we give our foot something to feel other than pain that's fast, so vibration or quick stimulus, things like that, then we are more often going to feel that instead of the pain. So that can be helpful for short-term pain relief, but it's not doing anything to actually heal the fascia. But as far as other things that you can do for that short-term relief, they have actually shown that arch support can help relieve foot pain in the short term. And this is where I think the conversation needs to spend a little bit of time, because arch support is one of those things that's very controversial at this point, at least in my world, because
Okay.
I think, and a lot of my colleagues believe that, again, we need to use the foot in order for it to function properly in the long term. Using things like orthotics, using things like really stiff supportive shoes is going to restrict the foot or do the work for us. So in the long term, most people, I believe, should not be in arch supports or in an orthotic or things like that, barring any structural abnormality. Someone with a
Yeah.
club foot, for example, that's going to be a totally different example. But your average person, long term, doesn't need something like that. But the research has shown in the short term, it can help to alleviate pain. So that's one of those things where if you came to me with back pain and I handed you a back brace, you would expect a plan to get out of the back brace.
Yeah.
And I think that's the piece that's missing from a lot of those treatment protocols.
That is interesting because I don't think we've ever thought of it like that before. Excuse me. I think we think orthotics are something that now you have for life, and that's just what you have because you have a flat foot or you have a foot that doesn't arch as well. Never
Yeah,
thought
there's
of it like that, that exactly like, are you going to wear the brace forever or are you going to strengthen the foot, right? Have appropriate actions to, heal the foot in order to not wear that brace or the orthotic. Huh.
absolutely. And that comes to the long term. So, there's definitely things that you can do in the short term to make your foot feel better. But in the long term, it comes down to strength,
Yeah.
because that's how we're going to alleviate that load on the foot. This is more for our visual watchers, but I really like kind of going through this with my patients where if I need this much capacity in my hand, let's say is about halfway up the screen right now for those listening. So if I need this much capacity in my feet in order to walk, I need this much strength, but I only have this much strength, right? And now my opposite hand is below my first hand. So if I need this much and I only have this much, something is going to go wrong. I'm going to have to rob the rest of that from another tissue. So what I need is to build up the strength that I have so that now my capacity is higher than what I need. And that's where coming in with foot strengthening exercises can be really helpful. And there's a lot of really simple exercises out there. There's complex exercises if we're trying to do more targeted approach and change biomechanics, but I think it really can be as simple as doing some toe yoga, which for many people is something that they don't know what it is, and that's perfectly fine. That's why we're here, right? So
Right.
basically, I want anyone listening right now, you can do this even in your shoes, but I want you to keep all 10 toes on the ground and then try to keep your outer toes on the ground and just lift up your big toes.
I can do it. I'm wearing bare feet right now. I can do it.
Good. Perfect. Okay. Now bring that down and try to keep your big toes on the ground and just lift up your outer toes.
That's harder, isn't it?
It
I can do
depends
it.
on the person. Some people can do
Okay.
the outer toes really well, and some
Okay.
people have a really hard time with the big toe. And some people are screaming at me right now where I can't hear them, and they're saying, "This is impossible. Nobody can do this." Right? but it is totally possible. And that alone isn't going to build up what I call functional strength, right? That's going to start rebuilding that connection between your brain and your feet and your ability to control your feet. But it's not going to use the muscles of your foot in a way that you actually use it when you're on your feet. And instead, that's where we would want to start using some banded exercises, pressing the toes flat. That's another key thing. One of the most common exercises out there. If you've ever been given a foot exercise regimen by a physiotherapist, physical therapist, whatever kind of provider you've seen, it probably included towel grabs. And
Yes, with the toes. Grab the
yeah,
towel with your toes. Yeah, okay.
grab the towel at the toes and or like marble pickups, that kind of thing. Unfortunately, those are my two least favorite exercises of all time.
Of all time. Well, we want
So
to hear your favorite of all time.
I will. So, but I want to just explain why,
Yeah,
because toes have four muscles that move our toes. And if you think about your fingers, it makes it really easy to understand. So if you have your fingers and you curl them down, right, that would be using my long flexors, right? Versus if I bring my fingers down flat, that's a different set of muscles.
for
They're
sure.
both flexors, but it's
Yeah.
a different muscle, right? We also have the same thing on the top. So we have our long extensors and our short extensors, which is what allows me to move from my more proximal phalanx. So at this point, right, we have four different muscles acting on our toes. The reason I don't like the towel grabs is because when I do this, I'm using my long toe flexors. These tend to be really overactive in the majority of people because when we have weakness in the foot, our main compensation is to grab the ground. So
Mm,
oftentimes those that don't have adequate foot strength are already gripping the ground with their toes. So now strengthening a muscle that's
right.
already dominant isn't going to help us. So any exercise that you do with your feet, keeping the toes flat. So pressing into even like a rolled up towel. If you roll up a towel and you put your toes on it and just isometric hold, press your toes flat, great
Okay.
place to start.
Yeah.
Because oftentimes people won't know what it feels like to fire those short toe flexors because they're so used to gripping with their toes. And when you start to do that, you should feel it underneath the foot and it should feel good, like a good muscle contraction. And you can get sore, just like you would expect to get sore from the gym, but
Yeah.
not the same kind of soreness you're getting from that plantar fasciitis.
And so would you do something like that daily?
Absolutely.
Yeah.
Yeah. I mean, it's all relative. I know there's a million other body parts that we need to focus on.
Yeah.
So I'm very, very realistic with my patients. I'm very realistic with my plans of, I know there's other things and there's big concepts that we need to be working on. So what are the few things that are going to give us the biggest bang for our buck? And that's activating the toes, even just lifting up and spreading the toes. Going back to the conversation about your boots, I have a question for you.
Okay.
So what did the toe shape of your boots look like?
Like a triangle.
So this opens up a whole new conversation
Do
because
tell. Do tell.
because our toes are actually designed to be the widest part of our foot. So if you think
Right.
about our foot here, and again, I've got my foot model.
Yep.
So if our toes are in alignment with our metatarsals, they actually will be shaped more like a pizza slice, where our toes are the widest part of that pizza slice.
Sure.
Right? If instead I'm in a shoe that now my foot is shaped like a diamond,
How dumb are we? That's all we wear. Oh, my Lanta.
right? Because, I mean, it's a very simple visual when you think about it that way. There's no way that our toes and our feet can function when they're being restricted in that way. And I can go down the rabbit hole into the biomechanics and the tie bar mechanism and all these things that are built in that
Yeah.
only happen when our toes spread.
Yeah.
But the gist of it is if we restrict our toe motion, we can't use our foot muscles. And the same concept we've been talking about, if we can't use our foot muscles, we're going to rely on that fascia instead, which is why your feet don't like those boots.
That makes so much sense. And this is why I feel so good when I wear my runners. you guys call them sneakers,
Yep.
daily, which I do, right? Like I'll start the day inside the house with my runners and then I just keep them on. And the other day too, I was wearing flip-flops because summer and such, but I also felt like my foot was starting to get a little bit pained in the flip-flop. So that allows the foot to spread, but now we've got absolutely no support anywhere. So do tell us about flip-flops and sandals.
Yeah, it's a great question. And I dislike flip-flops for a very different reason than the typical practitioner. And that is, I don't care about the lack of arch support because again, you have three arches built into your feet. And if our feet are functioning well, we don't need support, right? We need freedom. So I love sandals because they allow your toes to move. I love sandals because they're flexible and they're thin. You can feel the ground. You can move in all the ways you're supposed to. The only caveat to that is with flip-flops specifically, you have to keep them on your feet. And in order to keep them on your feet, you have
Grabbing.
to grab the
Oh my
ground,
gosh.
which is that same muscle imbalance we were just talking about, right? There's kind of two main compensations we see with flip-flops. It's either gripping or it's actually extending the toes to keep
Yeah.
it. But either way, we're creating a muscle imbalance. So I love sandals. Just make sure they have a heel strap. And there are definitely cute options that
Oh
have
yeah.
the heel strap now, but that's my one caveat is just make sure that your foot is secure because if it doesn't feel secure, you're automatically going to do weird things to keep them on.
Yeah. Why have I never thought of this? I don't know. That's really a great tip. So good. One of the how I actually found you is on your page over on Instagram, which is called Gait Happens. Yes. Gait
Mhm.
Happens. I'll make sure those are in the show notes for anyone. Is that you were doing this test on a treadmill, and one of the things was, do you blow out the top of your shoe? Like, does the top of your shoe ever have like wear and tear? And I don't anymore. These last number of pairs, I haven't had it maybe for years, but I totally recall blowing out the side of one shoe from a bunion. I'm just my feet are just gorgeous. Just wait for this. Um, and then the top of my foot, I'm like, why is it wear and tear there? And I just found it so interesting. Your little reel that you guys had posted was there is something to do with when we drive the toe up to take a step. Is there a shortness in the Achilles, or we're trying to bring the foot forward? Could you just tell the viewers and listeners all about that testing that you did?
Yeah, that's it's one of my favorite things to talk about because I did the same thing. So, and this is, as practitioners, as health pros, we were constantly learning about ourselves at the same time, right? But yeah, so this particular reel, we were talking about holes that you get above the big toe, and this can be in the shoes, it can be in your socks, and oftentimes, assuming that we have good pedicure habits, right? That it's not from something like that, then we're talking about something more functional. And what we're talking about is something called toe extensor substitution, which is
Okay.
a big fancy term for, again, if I'm not using one thing, I'm going to use something else. And so when we're walking, our foot that's on the ground is called our stance leg. The foot that's in the air that we're pulling through is called our swing leg. The
Okay.
number one goal of our swing leg is don't trip,
Yeah.
right? It's
Yeah.
that simple. We're trying to clear the ground to take a step without tripping over our toes. Now, in order to do that, we typically will bend at the ankle. So if I'm coming through with my foot here, I'm going to bend at the ankle in order to not trip on the ground. But if I have a limitation in that ankle, whether it's a tight calf, whether it's a joint restriction, whether it's a muscle imbalance, and I don't have great strength out of my anterior compartment, which is your tibialis anterior muscle. So any of these can lead to me not using my ankle. And if I'm not going to use my ankle, I'm going to extend my toes instead. And that's where you see when you're walking, your toes really kind of hyperextend when they come through
Yeah.
because you're trying not to trip over them. And now when you're doing that in shoes over and over again, your toes are poking up into the top of that shoe, which is why we get that hole there.
Yeah, they had a really interesting video in slow-mo of the toes lifting up so high in order to get that step in. So, like she said, so that they wouldn't trip. And Of course, that's going to impact the shoe, but not only that, you've got a tight calf or you've got a shortened Achilles okay, so say that is something that people have. We get the hole in the top of our shoe or we're burning out our socks. What sort of lengthening exercises then would you recommend for the calf or for the ankle joint? Mobility, maybe even.
Yeah, absolutely. So it all comes down to determining what is the cause, because sometimes people will do this when they're even hypermobile. So that's why it's kind of important to decide, is it a restriction in the ankle or is it a lack of strength? If someone has great ankle mobility, they're like, no, I can squat for days, like I know I'm hypermobile, then typically we're going to be working on something more like strength. I love tib raises for this.
Yeah.
Easy way to do it, like at home or with minimal equipment, is if you have a 10-pound kettlebell and you just stick your foot through the hole, through the handle, you can do a weighted tib lift. And that
Sitting
feels
on the
really
edge of your bench or chair with leg out straight or down
exact.
on the ground and then just lifting. Yeah.
Yeah, exactly. And if you want to protect your foot from that handlebar, you can use a pool noodle, like cut a little pool noodle and put it on the handle. Or I just put washcloths on the top of the foot. But yeah, that's one great way to work on strength. If instead it is a joint or a soft tissue restriction, then it's okay. When you're working on calf stretches, do you feel it in the calf or do you feel it in a pinch in the front of the ankle? A pinch in
Mm.
the front of the ankle is going to be more of a joint restriction. For that, I would say either visiting a practitioner that can help with that, help with mobilizing the joint, or you can do some more of those kind of banded exercises where you have a band looped around the front of the ankle that helps to distract that joint while you
Mm.
go into a calf stretch. That would be a good one. I can send you links to some of these too to give
Yeah.
you some video demos.
That's,
But if instead you do a calf stretch and you feel it in the calf, well, then it might be as simple as let's do some consistent calf stretching,
yeah.
because in order to change tissue length, you have to have consistency. You need to be holding your stretches for a minimum of 45 seconds. You need to be doing this repetitively. That's the biggest thing with true
Totally.
tissue tightness is we're just not giving it the chance and the consistency to actually make change.
I know. And it's because those physio exercises are so boring
I
to do.
know, I know.
But you're
I
right. Like,
totally understand.
I know. What do you expect? My favorite quote of all time by Ovid is dripping water on the stone hollows it out, not through force, but through persistence. It's the same with building muscle. It's the same with, improving your foot health. You've got to be consistent over time is the key.
It's not the sexy answer, that's for sure.
Well, it's
But
not. I know. We just want to wear our high heels and our thin pointed shoes and have no issues, but apparently that doesn't happen as we age. And you're saying there's could be some hormonal impact with the reason that is. Could you talk to us about that a little bit?
yeah, absolutely. So some of the changes that we see with the musculoskeletal system as we age, again, going back to that sarcopenia. So early sarcopenia can start as early as 35. We
Yeah.
know often it can start around the age of 50, which is even earlier than men, which is typically around the age of 60. So with that muscle to soft tissue balance, we constantly need to be working on strength, not only of our big muscle groups, but of our smaller muscle groups, because we need to be combating that muscle loss, right?
Right.
So that's one thing that we're fighting against, if you will. But the other piece too is as we age, the quality of our soft tissues changes. And so specifically talking about tendons and fascia, we lose stiffness as we age. So stiffness in tendons is actually a really good thing. We
Hmm.
want stiffness, right? That's not like, oh, I'm waking up in the morning, I feel so stiff. Like that's a
Yep.
different kind of stiffness, typically felt more in our muscles. What we're talking about is the stiffness and resilience in our tendons
Right.
in order to basically resist load.
Right.
And as we lose that stiffness, we're more likely to see tendon injury. So
Hmm.
it's really when you kind of look at age demographics and common musculoskeletal injuries, when we're in adolescence, it's really common to see more of your bone injuries, right? Where it's either some kind of stress reaction or traumatic bone injury because we're kids and we do crazy things, Then we go into kind of the 20 to 35 year range where you're typically seeing more joint related injury, not joint like arthritis, but joint related injury, impingements, things like that. Once you get over that 35 range, when you're going into more hormonal changes, this is where we start to see changes to the soft tissues. And that's where you start to see more soft tissue related injuries like plantar fasciitis, Achilles tendinopathies, IT band syndrome, any of these things that are going to be helped by strength, because tendon stiffness can only be increased through load.
That's
So
right.
any kind of resistance exercise that we can do to help with that is going to be kind of twofold, because you're going to combat against that sarcopenia, but also increase the health of your tendons.
It all comes down to moving daily, folks. I've told you that
Yes,
before.
it really does.
I've told you that before. Let's talk about bunions and hammer toes here. Actually, someone wanted me to ask a question. She said there's such a thing as a bunion and a bunionette. I'm like, I don't like the name of that, but okay, bunionette. You're trying to make it sound fancy and fun. Like, oh, I've got a bunionette. No, talk to us about those things. And I've never had it diagnosed, but it sticks out on the inside of my foot. So I'm guessing that's what it is. But it doesn't hurt. But what causes bunions? How can we prevent them? And if we have them, what can we do to make it not so painful?
Yeah, great questions. So first of all, a bunionette, you're going to laugh because it's very simple. So a bunion happens on the big toe, a bunionette happens on the little toe.
Yeah.
So
Yeah.
the bunionettes are also called Taylor's bunions. That's the
Technical term.
yeah,
Yeah.
typical term. And that's a whole like funny story, but yeah, like shoe tailors used to always sit in a weird way so they'd get Taylor bunions, but
Oh,
that's
okay.
but bunions themselves, actually, let's start with hammer toes. Let me go back because
Okay.
I think
Yeah.
that one will be a simpler answer since we already kind of touched on it. So with hammer toes happen when we get that curling of the toes, typically in the outer toes. So we're not talking about the big toe right now. We're talking about toes 2 through 5.
Okay.
And when those toes curl over time, if they continue to stay in that curled position, they can become rigid in this position, right?
Okay.
Similar to if you think about like someone with not great posture, where over time, then you see them when they're 60, 70, 80 years old, they're not able to get into thoracic extension at all anymore.
Yeah.
Over time, if we don't use it, we lose it. The same
Yeah.
thing happens with the toes. So if we're in this curled position constantly, this can become rigid where we no longer are able to flatten the toes. The biggest key concepts there are number one, if you're at a point where your toes can be flattened, where they're still flexible, you need to be working on that soft tissue mobility. You need to be getting in there and making sure they stay flexible for as long as possible. But you also need to work on why are we gripping the toes in the first place, which comes back to that foot strength, right?
Right.
So making sure we're engaging the toes flat into the ground. Lift up your toes, spread them out wide, reach them out long, and then press them into the ground. We call that a lift, spread, reach, and it's going to target so many different foot muscles. And it's
Yeah.
very you can do that while you're watching TV. You can do that in the
Yeah.
shower when you want an extra 30 seconds in the shower, right?
Yeah.
That's my favorite time to do foot exercises, by the way.
Great tip. Yeah, that's a great tip. Foot is warm. You're just there anyway, camping
It's
out.
like,
So
oh, I just
yeah.
want to stand here. Oh, I have to do my foot exercises. Sorry, I have to be in here another 5 minutes. Like,
Sorry. I'll do 5.
yeah.
Okay, so that's hammer toes. Like when you're talking about it, I don't have that, or I don't even think I know of anyone that has that. But would putting like a book on top of your foot and just letting those feet, do you do that? No, no book.
Yeah, I mean, I don't do that. It's a great creative idea. I love it. But typically I'm usually more using fingers, like when you're sitting on the couch or something to get in and really massage the joints and
Okay.
the yeah.
Yeah. Okay. So back to bunions then. What causes them and your little bunionette or your Taylor bunion, and what can we do to prevent that?
All right. So bunions are caused by instability. Let's talk bunions. We'll go mostly bunions, and then it's just kind of the same concepts on the pinky toe for the bunionettes. But with bunions, we're talking about an instability of what's called the first ray. So it's your big toe and the metatarsal that lives behind it. And when we don't have stability here, we get a ton of extra motion. Now, there's a couple of kind of thoughts around bunions. Forever, we've been told that they're genetic, right? My aunt has bunions, my mom has bunions, my grandma has bunions. So for a very long time, it was thought that they were genetic. Now, research is showing that although there's probably a genetic component, because as women, we're already more prone to hypermobility, but also genetic hypermobility is a thing. So if we're already tending towards a lot of motion, we have a higher risk of bunions, but that doesn't mean that you have to have bunions, right? Just like if you're at a higher risk for diabetes, I hope that you would do
That's
something
right.
to prevent that,
That's
so
right.
same
Yeah.
kind of arena here. Now, when it comes to the actual mechanics, a bunion, what it is when the metatarsal, which is the long bone behind the big toe, starts to deviate outwards. So it kind of starts drifting away from its neighbors and starts going outwards. The toe itself starts drifting inwards. And what you end up with is a bump on the side of that big toe joint. That bump isn't a growth. It's not any kind of like growth of bone, which is what a lot of people think.
Right.
It's actually the top of that metatarsal bone starting to,
Okay.
right? Now, what you can kind of see for those that are watching is when we do that, obviously this joint, which is designed to function straight up and down, is now like a door that's on a crooked hinge,
Oh dear. Yeah.
right? And over time, we're going to create irritation, not only of that joint, but of the tendons that make that big toe function,
Yeah.
of the sesamoids, which are these two little bones under that joint, which are like little mini kneecaps for your big toe.
Okay.
All of this stuff can get really irritated. So oftentimes people with bunions don't only have bunion pain on the side, they also have pain on the top of the joint because there's restriction there, or they have pain underneath in the sesamoids, or they have pain along the arch because those tendons and muscles can't function the right way. So it all comes down to a matter of function, not just the way that it looks, which is not our favorite thing either.
Yeah. Yeah. Not in sandals, especially. Okay,
Yeah.
so you have it. Now, can you reverse it? I have heard of people getting surgery. What can you talk to us about those two things?
Absolutely. So there's a scale of bunions. So we have mild, moderate, and severe bunions. And so when it comes to mild to moderate bunions, which is the vast majority of bunions, there is a ton that you can do to improve the function and to an extent the aesthetic of the bunion. So it all depends on the severity and kind of the mechanics, where you can improve the alignment, you can improve the strength. And with that, oftentimes there's redness around the joint too. That can go down. And most importantly, pain, right? Especially if bunion pain is restricting you, you can absolutely do stuff to decrease your pain. So that's where our function is those, or our focus is the mild to moderate bunions. When you get into more severe bunions, especially if they are painful, that's where surgery can be an option. And
Yeah.
there's multiple surgeries out there. There's a bunionectomy, which is where they actually will cut this bone and then realign the toe, and they can do that with or without a pin. There's actually a
Wow.
pin sometimes that they will do at this joint back here to try to bring alignment back to the metatarsal. So there's multiple options there. But my caveat with surgery is the one problem with bunion surgery is that 1 in 6 bunion surgeries fail. And
Oh,
that's a really poor recurrence rate. So one out
yeah.
of 6 people who get a bunion surgery get the bunion back, is what that means.
Because they are not doing the work that needs to be done in the first place, right?
Exactly. That's my thing is like not, and it's not only I'm not blaming the person because nine
No.
times and they're not getting a prescription for rehab with it. They just say, okay, your bunion's fixed, go ahead. So there's
Yeah,
nothing wrong with the surgery itself. There's
sure.
nothing wrong to an extent, right? I don't want unnecessary surgery, but when it's needed, there's nothing wrong
Yeah.
with the surgery itself. I just don't think that they're then changing the reasons why they got the bunion in the first place, and then it comes back. So in those cases, right? So whether it's a mild to moderate bunion, or someone who's post-surgical and wanting to prevent that recurrence. This is where, again, you're going to hear me say strength, right? But strength for that big toe is really important. We actually have a really big muscle on the inside of our foot. It lives over here. It's called your abductor hallucis muscle, which is specifically a muscle that brings your big toe away from the other toes. That's its only function. It's really big, and all it does is bring the big toe away. This is one of the muscles, in addition to the muscles that help stabilize this first ray here, like your peroneus longus, for example, which you can use in order to create more stability of the big toe. Simple ways that you can do that. Again, the lift, spread, reach is a great place to start. You lift up those toes, you spread them out wide. So now you're firing that muscle that brings the big toe out. And oftentimes when you do that for the first time, it's not going to move. And that's okay, because part of that is rebuilding that connection with the brain, because you haven't fired that muscle in a really long time, you know? So that's one of the very simple exercises that you can start with. We also like doing, we call it a pen touch. So if you put your foot on the ground next to a pen, or even just use a line on the ground, and then you lift up your big toe and you try to tap that pen, right?
Okay, good.
So
Yeah, I like it.
those are great ways that you can fire up that muscle to start strengthening the foot. But the more that you can just use your foot muscles in general, the more stable your foot is going to be. And a really easy way that you can do that is walk barefoot, right? Going back to all of the plantar fasciitis, the hammertoes, the bunions. If you want to improve your foot health overall, walk barefoot. And that might sound really scary to some people, because there are people who the second they're out of bed, they have slippers on, or they have their house shoes, and then they go outside and they're in shoes and they're never feeling the ground. But think about all the motions that your foot is designed to do that it can't do when it's in shoes, you know?
Do you ever do barefoot training?
Yeah.
Do you
Absolutely.
recommend that? I mean, you're not allowed to in gyms, but for my channel, most people work out at home. Of course, safety, you want to be cautious if you're lifting heavy weights, of course, but there are lots of like body weight workouts that I'll do. Is that something where you would want to maybe just remove the shoes and train barefoot?
Absolutely, yes. So number one, just build up, right? So just like you wouldn't walk into the gym and start to try on day one to deadlift 300 pounds. So let's not go for a marathon barefoot. Let's just put that out there, right?
And we
But
have to put that out there. Yes. Start slow, folks.
But building up, right, with a little bit of a time at a time, whether that's walking for 5 minutes, if that's where we need to start, or if you're used to being in barefoot all day in your house and you only wear shoes outside, then you have a little bit more leeway to start with. But yes, building up to a point where you can do your workouts barefoot is amazing, because then you're getting all different kinds of stimulus and balance and movements, and it's a great way to build foot health. And by adding load, right, you're also going to contract those muscles more. Like we said, the more load on your feet, the more you use your feet. So by doing like a farmer's carry, you know, with weight, you're adding weight to your feet at the same time. Sled pushes. I know that's not at home, obviously, but sled pushes are a great way. If someone has a treadmill at home, I have my patients all the time walk on their treadmill with it turned off. So just pushing the treadmill belt is like an at-home sled push, but really focusing not just on the push and like the big muscle groups, but focusing on rolling through your foot with each step will totally transform the way you feel that exercise.
You know, so much of what you're saying here, I do hear referred often on Ben Carpenter, who's the knees over toes guy. I don't know if you've heard of him, but he's all about promoting knee health. And so much of it is strengthening the tibialis anterior. It's, you know, doing the sled pushes. I mean, it just, if you want good knees as well, it starts 2 joints below or 2 joints above, right? So get those feet healthy and it's going to improve knee health too. I bet you see that a lot.
Oh, absolutely. Absolutely. The knee's only as stable as the foot or the hip that drives it. Right. So absolutely, totally agree. Yeah. And going back to the working out barefoot, if you are in a gym, that's why there's so many more options now for barefoot shoes. So
let's talk about those minimalist shoes or barefoot shoes. I saw you guys walk into a place in Colorado that's now has a, you know, you can try them on and such, but I also interviewed a shoe fella here, a shoe guy here the other day at our local play store. And he said that the Vibram shoes are making a comeback, those minimalist shoes. So talk to us about
Five
that.
finger. Absolutely.
Five
It
finger, yeah.
comes back down to, again, let the foot be a foot. So if you're in a shoe, that the less shoe you have, the more your foot has to work. And that's a good thing. The more
Right.
you're actually going to use the muscles, the more you're going to use the joints. So barring any structural, like if you have a pin in your big toe or if you have severe arthritis, right? Like barring structural considerations, the average foot, let it
Yeah.
move. So
Yeah.
that's what barefoot shoes, minimalist shoes, natural shoes, that's what they're designed to do. So they're typically very thin, they're very flexible, they have a nice wide toe box to let your toes spread, right? So for those watching, these are Biancas. I have a whole closet of different brands, and we have a whole list of brands on our website too.
Oh, great. Okay.
I can roll all of my shoes up into a ball. I can twist them, right? My shoes are not restricting any kind of motion from me. And then they have that nice wide toe box so that I'm not interfering with my toe motion or my muscle activation of my foot. So if you can't work out barefoot, working out in a minimalist shoe is a great option. The only kind of consideration for that would be obviously there's no heel to toe drop. So now you're in a totally flat
Yeah.
shoe.
Right.
So if you have ankle limitations and you're trying to do things like squats or things like that, then just grab
A
whatever
plate.
kind of
Yeah.
plate lift you need in
Yeah.
order to get into those ranges of motion. But for the majority of your lifts, this is a really great option. There's actually I call it my party trick, but I learned this in school. So you'll have to try it sometime, and you guys can try
Okay.
it with a friend. But if you so there's a way to test glute max. Basically, if you're laying on your stomach and you have your knee bent, so your foot's up in the air, right?
Yeah.
If you lift up that leg and then someone tries to push it down, you're
Okay.
testing your glute strength.
Right.
Okay. You following me? Does this make
Yep.
sense so far?
Yeah, totally.
Okay. So if we're laying on our stomach, we lift up our leg and they push down on the back of your thigh, you're testing how well the glute is firing essentially.
Right.
Now, if you do that and then you grab the toes, so you hold the toes together like you would in a restrictive shoe,
Yeah.
it will automatically like not fire. You will easily be able to press down their leg.
Wow.
And if you work on spreading the toes and kind of
Yeah.
massage the toes a little bit and spread them back out, it'll pop right back up. It's the coolest thing to see. So
Yeah.
it's not just the foot function that we're affecting by allowing those toes to spread, it's that whole chain.
Yeah, that makes sense, actually. I'm going to try it after this filming here just to see what my toes do in the barefoot position when I'm pushing up. Like you said, you have to have someone pushing down or whatever, but I bet I can visualize my foot would spread to push against load. And if
Yeah,
they're not able to spread, what's going to happen? Like you
exactly.
said, something else is going to take over. Very interesting. Can we just finish off with maybe some of your recommendations for a good foot care routine? Are there things that we should be doing regularly, maybe products that you would recommend we use just to ensure the health of our foot?
Yeah, that's a great question. So obviously, you don't have to do a million things, right? Like, let's just keep it simple. So I would say a good routine is going to work on mobility and strength. So starting off with rolling a ball under your foot, that would be a great way to stimulate the nerves under the foot, get the tissues moving, let the joints move a little bit. That's a really great way. Do a minute to 90 seconds on each side. Then you can start with a little bit of that connection. So doing the toe yoga, where you try to lift up your big toe by itself, try to lift up your outer toes by itself. If you have a bunion, when you lift up that big toe, try to keep it away from its neighbors.
And
So
then if you
lift
have a bunion net, you're trying to keep it away from the other neighbors, right?
exactly, right? And then doing the lift, spread, reach. So
Yeah.
lift up the toes, spread them out, and then press them down flat. If you want to add a little bit more tension to that, you can do it with a band. So if you stand on a flat TheraBand and
Mhm.
you put it around the front of the toes, now you can press into resistance. And that's a
Sure.
really great way to build strength.
Yeah.
So you do those three and then maybe add in some calf raises,
Yeah.
right? Calf raises, making sure you're moving through that big toe, not just flaring out onto the outer toes, but really getting kind of the whole ball of your foot. you have a pretty well-rounded routine right there.
Yeah. Yeah.
And that's again for your general health. There's definitely, I mean, I have a library of 200 exercises that I pull from in order to recommend specific things for specific people. But really, if you're working on your general foot health, you can be very preventative and you can help with a ton of different things just by working on those things. As far as the products go, one of my favorite things that I do recommend for a lot of people is toe spacers. Toe
Yeah.
spacers they're made out of silicone. There's
Okay.
a million different kinds out there, but if you think about when you get a pedicure, like the thing that
Yeah,
goes between,
that's right. Yeah.
yeah, it's like that, but it's made out of silicone and it's a little bit more streamlined so you can actually walk in them. And that's
Okay.
my key point is when you're looking at toe spacers, make sure that you get a kind that you can actually wear on your feet. Because it's one thing to passively spread your toes when you're watching TV or when you're sleeping, but it's another thing to keep those toes spread when we're using those muscles and we're loading up our feet.
Yeah.
So that's my kind of caveat for toe spacers. And then otherwise, there's a million other things that you can use to strengthen your feet. I'm happy to talk about any of them, but that's
Yeah.
kind of the general basics.
Yeah. That sounds so good. Yeah, that's excellent. Thank you so much. That was a wealth of information, and I'm definitely going to make some changes to my little protocols here. Uh, Unfortunately, those boots are for sale. Are now for sale. Oh,
Yeah.
they're already gone. That was 2010. But you know what? It's same as I age, as if I ever want to wear high heels anymore. I do love the look, but I'm all for comfort now. So yeah, I'm all
I like
about
to think
comfort.
about, yeah, I like to think about shoes as a shoe diet, right? If the majority of our footwear
Yeah.
is healthy, or if we go barefoot, then one
20% of the
high
time.
heels, right, is not going to kill us. We know
Yeah.
we're going to suffer the consequences, just like we
Yeah.
would for that buffet meal, right? But if you go into it knowing what to expect, then the rest of your time is healthy, then it's going to be okay.
Jen is saying the 80/20 principle applies here as well, folks.
Yeah.
There you go.
Call it 90-10 for your feet, but yeah.
Yeah. Okay. 90/10. We'll take that. We'll take that. Well, thank you so much. Could you tell our listeners and viewers where they can find you, maybe where they can work with you or get involved in any of your programs?
Absolutely. So I am the co-founder of Gait Happens. So we are an online education company. We have virtual consultations. We work with clients all over the world. So you can find information on that at Gait Happens. That's GAIT happens.com. We also have a kind of do-it-yourself program. So we have like a 12-week, it's called the Fit Feet program, which is 12 weeks of progressive exercises where you get sorted into a program after taking a quiz to see which program's best for you.
Oh,
And we
wow.
also have a combating bunions course, which is specific to bunions. So we have lots of options there. And then if you're in the Colorado area, or if you feel like coming for a visit, I am in Colorado. I have a practice with my husband called Kinetic Chiropractic in Lafayette, Colorado.
Amazing. Well, thanks so much. That was, like I said, just a wealth of information. I'm going to go back and listen to it again, write notes. Thanks for joining. As always, everyone, go move daily now in your fitness, wellness, and nutrition. And we'll see you on the next Move Daily Talks.